State governments and U.S. healthcare. This RealPHN podcast starts with, it's one of my favorite topics because states play such a critical role, lumped with local governments as far as stakeholders, but they're vastly different. So this is about states. They're separated due to the magnitude and the differences. States serve that sandwich role between the feds and the states and local, and they face gigantic challenges but really important opportunities. And I'll go out far enough to say healthcare by state is going to be driven by how well the states do. States have their own model and roles in the proposed ideal U.S. healthcare system outlined in RealPHN publications. The discussion process is we're going to use the ideal healthcare model structure, and against that we're going to apply content from RealPHN's Health State Handbook. Welcome aboard. The ideal healthcare model are local health teams. We've been over that several times. But here we have it. We have state governments. We stuck something in there. It looks like universities. But you've got the insurance and health plans and the local health systems and the centers of excellent health systems. That's an interesting complexity. But if we drag that excellent ideal healthcare model along, individuals, personal health nurses, social determinants, Medicare, primary care, and information. Is it possible for states to approach healthcare with that in mind? It's pretty interesting. So I'm going to go to the Real Population publication. It says, first and most critical is to face the gaps or not gaps in care as normally seen by medical and academic communities. The gaps are major gaps across life fundamentals: health equity, housing, transportation, social determinant, daily living. Recognize that real population works. It's not experimental. It's operating in proven positive results. And resist turning real population into another product or program. It's about information-rich, system-supported relationships, long-term relationships. How can those fit into the state position? Hard to manage. Continuing from the publication, select pilot sites to start small. And I know from our experience here that we're going to have an enormous shortage of nurses in rural America. So starting with the small areas is probably going to include connecting with academia to educate more nurses. Make it work in the pilots, build a major expansion plan, and build educational programs around population health. That smacks of it all, doesn't it? It goes from being educators to on the ground in small communities and back to educators. In summary, state governments serve gigantic roles in residents' daily lives, health, and healthcare. They provide substantial social determinants of health across education and just all the functions of life. Health and healthcare are extremely complicated from many state perspectives. They go all the way from educating in the great universities and centers of excellence to local community health for rural and urban populations. Major changes are needed. They directly impact states, various populations, especially the aging populations, and related to jobs, education, and economic impacts. States serve gigantic roles, and integrated with employers and other stakeholders, substantial positive change can occur. Thanks for attending.